A commonly prescribed drug to treat high blood pressure may have another beneficial side effect.
Certain blood pressure drugs may boost brain power and reduce dementia. Dr. Zorba Paster joining us from his clinic in Oregon. Hello, Zorba.
Hi, Zorba.
A pleasure to be here on this beautiful day.
Let's start out with the basics. What are ACE inhibitors?
Well, ACE inhibitors are a group of blood pressure pills very commonly used as first-line blood pressure pills. The most commonly used first-line blood pressure pills are diuretics, ACE inhibitors, and drugs called calcium channel blockers. The ACE inhibitors are also very useful for patients who have congestive heart failure. And in this particular study, people who were followed over a period of time were found to have less dementia. They were found to do better on brain tests, and if they had dementia, it seemed to slow the progress of the dementia itself. And this really is good news because patients who have dementia, either Alzheimer's disease or dementia from small strokes, often have high blood pressure, and if these drugs will slow dementia, that really is excellent news.
And if that's the case, do you think maybe they would be appropriate for people who don't have high blood pressure? Maybe just to reap the other
Very
benefits?
good question. Excellent question. And I don't think we certainly don't know that right now, but I'm sure there are going to be some studies that really look at that. And when we look at dementia globally, about half the people with dementia have Alzheimer's disease. We don't know what causes that. The other half of the people with dementia often have cholesterol problems and blood pressure. So looking at that half that we can really do something about, it means keeping your blood pressure under really good control, keeping your cholesterol under really good control. We know diet and exercise plays a role. We know people who exercise do better. And in this case, if you need a pill for blood pressure, I think ACE inhibitors clearly may have an advantage, especially if you've got a family history of dementia. Now, my mom died of dementia. I don't know if it's Alzheimer's disease or high blood pressure because that was back in the 80s. But frankly, this is a drug that I certainly would consider being on because it may help prevent that in my case.
What is high blood pressure? Is it different for every person?
Blood pressure, high blood pressure, we don't precisely know what causes it, but it's basically caused by dysfunction of the kidney and also dysfunction within the whole vascular system. And we now know that there are many things that are factors into high blood pressure. And today we have really good pills that have minimal side effects compared to the pills years ago. A lot of the reason that we are living longer today is because of the treatment of high blood pressure. And 120/80 is really the optimal goal for pretty much almost everyone.
Very interesting.
Yeah, interesting stuff. All right, Zorba. Thank you.
Yes.
Good to see you,
Take
Zorba.
care. Pleasure to be here. Good to see you.